Dr. Rashmi Halker Singh. I'm the Deputy Editor of Headache. It's my pleasure today to be joined by Dr. Juliana Chichorro, who's one of the authors of a recent publication entitled Lifestyle Triggers of Migraine, Sleep Restriction and Caffeine Lower the Threshold for Migraine-like Responses in Rats in a Sex-Specific Manner. Welcome, Dr. Chichorro. It's so nice to speak with you about your work.
Thank you very much for having me here.
So first of all, your study looks at two very common lifestyle factors, sleep restriction and caffeine, and how they influence migraine biology. What motivated your team to explore this specific interaction?
So in this study, we tried to see the interaction of caffeine, which is one of the most used illicit drugs in the world, and how it interacts with sleep restriction that we know that's very common in the actual dates and population, right? So we want to see if this interaction could increase the susceptibility of migraine. And also we want to see if there was some sex difference in these responses.
Yeah, I think that's very interesting. One of the concepts that you talk about in your paper was lowering the threshold for migraine-like responses. Can you explain that a little bit?
Yes. So we used male and female rats, and we used the protocol that causes sleep restriction in them. So for 3 days, we prevent them to sleep for 6 hours each day. And it's a very mild protocol. There was no stress involved. And after this period of sleep restriction for 3 days, we inject them with triggers, migraine triggers, very known in the migraine field, which is CGRP and PACAP. And then we saw that this combination of sleep restriction with CGRP or PACAP would increase the susceptibility of males to have a migraine response. But it did not happen in males. So there was a sex difference in the susceptibility. Sorry, can I start over?
Of course.
I have to change this word.
Sure.
So in this study, we used a protocol of sleep restriction where we use a gentle handling method there's no stress involved. We prevent the animals to sleep for 3 consecutive days, male and females, and then we expose them to non-mediators of migraine, which are CGRP and PACAP. And we saw that when we do this protocol, combined protocol, sleep restriction plus CGRP injection, we provoked migraine-like responses in females, but not in males, suggesting that males are more resistant to develop migraine-like responses when they are subjected to these different triggers. And then we want to add caffeine in the story because we know that caffeine is very useful when you are sleepy and you take this every day for many reasons. And when we combine caffeine and sleep restriction, then we saw a response in males. So caffeine is a modulator of the trigeminal vascular system in any way that we don't know yet. But this combination in females caused a greater response. So they are more sensitive to the CGRP or PACAP when sleep restriction is combined with caffeine.
I think that's very interesting. And I want to go back to something you said. You shared that a major finding in the study was that sleep restriction increased susceptibility to migraine-like responses in the female rats, but not in the male rats. Why do you think there's a sex-specific difference in this vulnerability?
We actually don't know if males are fully resistant or if we increase the doses, for example, for CGRP or PACAP, they're going to show a response. But in this protocol, we only saw nociceptive responses in females, suggesting that females are more sensitive to sleep restriction plus caffeine plus CGRP and PACAP. However, the association of CGRP or PACAP, sleep restriction, and caffeine in males also provoke the nociceptive response. So I would say that this combination is not good for migraineurs. And there's a sex difference. I believe that mainly in the sensitivity than the response at all. Males can develop this response, but they are more resistant than females. And the reason why this happened, we don't know. We have to explore, to work more on that, to see, to try to understand these differences.
So that's future work, basically.
Thank you.
So, your study was mainly done on rats, but as a
Yes.
physician who takes care of human patients, what can I take from your work and how do I apply this to my human patients?
So it's very complicated to have a direct translation now for humans because we know that there are many differences between species, right? But we can say that you can pay attention in the patient habits, intake of caffeine, how much he intakes. Sleep is very important for migraineurs. So this association maybe is a trigger for some patients to take a lot of caffeine, to not have a good sleep. Maybe it's the main reason for triggering, increasing the attacks frequency or the severity of the crisis. So we are just starting this work, so there's much to do and much to know about it. But I think the main message right now is to pay attention to the patient in his habits and everything to see if this may complicate the situation, just make worse the condition. Caffeine intake, worse sleep, and all the habits that the patient may present.
I think your study is very interesting and validates many of the things that our patients share with us. So I really appreciate the work you're doing, and I look forward to more research from you and your team. Thank you so much for taking the time to speak with me today.
Thank you so much.